So, happy Saturday and welcome once again to Power Time. This is Sharon Herbert, the Power RN, and we're here today once again to share the fabulous news in the world of nursing. Every week we have something new. So today we're wondering if you'd like to be a nurse mentor. You know, you know what a nurse mentor is. They could be called trainers, preceptors, but a mentor is an experienced or trusted advisor. That's what Merriam-Webster says. That's as a noun. And as a verb, Webster says the mentor advises or trains. And that's what you all can do. You've worked for more than 5 minutes, or I'll give you, 2, 3 years. You could be a mentor. But certainly, if you've been in nursing longer than that, you've got a lot more under your belt that you can share with new nurses in order to help them grow and to be comfortable and confident in their skills. I know you can. I know you can. I have been a mentor for some time now, and I still love it, and I reach out for the most part to student nurses. I find that they are so needy, and once they find out that you can help them, they are really ready. They're really, really ready because they don't know how they're going to become this great nurse without someone helping them. So that's what mentors do. You help them to get started safely and confidently to build upon the instruction and education that they've learned in nursing school so that they can become a caring and empathetic clinical expert and a great communicator. So those are the things that you'll be sharing with them. And, mentors can play a powerful role in a nurse's professional life. And as I find, and I can remember myself, that I really did not know what I was going to face until I got to the clinical. You're in the classroom, they draw pictures, and you go to the skills lab and do your blood pressures on each other, and change the trach on a dummy and do CPR, and those aren't real people. So you teach them how to connect with real people, the patients, and the rest of the healthcare team. So those are the things that you really know already. And it's almost easy for you to be able to spout that out. So, can I stick in my little hashtag? Mindset matters. We've got to help these young clinicians, new nurses grow. And this is November. So we've had a few months of new graduate nurses, and they have orientation and they have class programs. And then they get a chance to follow up that portion of the training with being connected with a seasoned nurse that can help them further grow and complete the orientation. And that can be a challenge, but I know you can do it. I know you can do it. So we're helping support those new nurses and providing them with tools to grow. Now, we know that nursing is a most rewarding profession, and we also know that it can be physically and emotionally challenging. So let's get a new graduate nurse, take them by the hand, and be a friend and teacher to them. They need your help. And new nurses coming into the field have only maybe not even had so much clinical because of the pandemic. So they really, really, really need you to help them. They're scared, and they should be. And if they're not, wow, that's its own issue. But mentoring new nurses in a safe place gives them a chance to grow their practice and to ask questions comfortably and not risk or fear that they are afraid to speak out in front of others and be called some other kind of name or feel that they are not up to par on this job. In nursing school, of course, they learn terminology and procedures and practices of nursing, and that's, in the book. But now they have to learn how to connect those words and connect the dots, I would say, to the diagnoses. And then they have communication and relationships and social issues and culture to all wrap up in that same one setting. Oh, wait, I forgot about workload. So they've got all these things that they're going to have to learn to do, and you know how to do them. So help them out. Help them out, and it's the best thing that you can do for them and for the community of nursing, because so many nurses, have left the profession because of COVID and some other things that may even be related to the workload, the workplace, the workspace, stressors, not enough equipment, la di da di da. Not good things. But some folks have chosen to leave. And that is always someone who already has experience. And now we're running around trying to, stick our finger in the dike like the little guy, the Dutch guy, and that doesn't quite work. So it becomes harder for everybody to get along and to get along safely. So becoming a mentor is a place and space for you to grow as well. So some of the benefits of becoming a mentor are being able to help new staff grow. That's number one. Number two, being able to help that new staff become more confident in their practice. And number three, it helps a mentor as well. Really? You didn't think I was gonna give you any credit. Right, here I am. So mentors also are recognized for their skills, their expertise, and their leadership components. So you're an expert already. So share that with someone else. And let's make mentorship to help make better nurses on the new nurse side and the seasoned nurse side. So mentorships can make better nurses on both sides. And mentorship provides a platform for excellence for all of us. So be well, and we need to still work on our own selves, mindset, challenging ourselves to be our best always, always, always. And no, it's not easy. But as I say, that road can be manifested with lots of challenges. But get a friend. Teamwork makes the dream work. So let's work together to get through some of those challenges, or as we call them, pain, and continue to be your best you, exploring or restoring your own passion and purpose and power in nursing. and getting back to the place that you enjoy nursing still or once again. We need you and we love you, and the world loves you. So let's talk about mentorship, helping new nurses get on board, and how to sustain your own passion, purpose, and power. So reach out to me, the Power RN, because you know I'm on Facebook, Instagram, LinkedIn, Twitter, and let's connect because I have a program and I have a system that works to help you get through your own stress and pain, but also find a place and space to help our new staff get connected and become excellent clinicians and providers as well. We don't want to leave them behind. And even in our own panic, we just have to take a moment and remember who we are and where we are. So find your power. You can reach me, as I said. Most times I'm sitting right on Facebook, but you can reach out to me at www.powerinnursing.com. I'm coming to you live today, and I will be here so many other times. I'm working on a new challenge for you all. So we've got some work to do, and we can do it. And I will be starting a mentorship program. So let me know if you would like to be a mentor. You know, once this group of new grads is finished, a new group will come after the September graduations. So let's get ready to become nurse mentors. Thank you, and we'll see you next time on Power Time. Have a great Saturday and a lovely and blessed weekend.